has been so many changes in the UK immigration recently, and like we all know that the UK tax year or the financial year begins from 31st of March to 1st of April the next year. And during this period, there are so many changes that takes place, which I'm sure most of my viewers has experienced this change. I've received so many messages from my beautiful viewers regarding the code 6131, the NHS recruitment, the IHS fee for everyone working with NHS. Like, I've received lots of messages from you guys, and the salary threshold for different, which is why I have to film this video on the impact of these changes to the UK immigration. This was published on the 18th of April 2024, which was just a few days ago. Hey guys, welcome back to my channel. My name is Fajira. If you're joining me for the very first time, I'm so happy to have you all in our beautiful family. For my returning subscribers, thank you for always coming back to watch my videos. I really do appreciate. I create content on how you can migrate to the UK, jobs with visa sponsorship in the UK immigration update, like everything you can think about the UK. In today's video, guys, I've got all your questions answered by NHS. I think I've got about 13 scenarios. I'm sure you will definitely fall in one of the scenarios I'm going to be sharing today. So just as you can see on my screen, impact of the changes to the UK immigration. Learn more on UK immigration policy for those on a health and care visa or skilled worker visa. Healthcare visa applies to those on health and care visa, such as nurses, doctors, allied health professionals, etc. A list of application rules can be found on the Gov website. Now, I'm going to leave every link I'll be mentioning in this video in the description. The health and care visa is a subtype of a skilled worker visa. During the application process, candidates will be asked if they are applying for a health and care visa, and we need to select yes. Only CQC registered providers in England will be able to sponsor care workers or senior care workers. This is not really new, but I got to find out recently that it's not all NHS that actually recruit for code 6131. One of my beautiful viewers just received a C.o.S. and it was code 6131, and it wasn't NHS that employed her, but she got the code 6131. I'll film a different video on that so that you don't have to just rely on only NHS when it comes to code 6131. Salary threshold, national pay scale rules. The minimum salary threshold will increase to 23,200 for occupations on national pay scales. A lot of people have asked me about this. Just to let you know that it is 23,200 pounds for occupation on national pay scales where applicable. That's a good number of people have asked me about extension of their visa if they still have to meet the new salary threshold. Just as you can see, to apply to both new application and to extension to existing visas. Guys, please like and share this video with your friends and loved ones. I'm sure it's going to answer most of their questions. Salary threshold not on the national pay scale rules. The general salary threshold will increase to 29,000 for occupation on a national pay scale. This will apply to both new applications and to extension to existing visas. The C.o.S. code 6131 that one of my beautiful viewers shared with me, I think the salary was 29,200. Just as you can see as well, immigration salary list for health and care visa occupations on the ISL, laboratory technicians, pharmaceutical technicians, care worker and home carers, and senior care workers. The salary threshold is set at either 23,200 or the occupation specific threshold, whichever is higher. Now, immigration health surcharge. I've received a lot of messages regarding the immigration health surcharge, saying that they were told that once they get a job with NHS, them and their family, they are exempt from the IHS. Just as you can see, immigration health surcharge, current and future visa holders will continue to be exempt from the IHS, provided you are on a health and care worker visa. You'll be exempt from it. But if you get a job with NHS on the skilled worker visa, which is not the care worker visa, let's say you get a job as a data analyst or a researcher with NHS, you will have to pay IHS for you and your family. Now, for dependents, just as you can see, health and care visa holders can still bring dependents to the UK as part of their visa, except care workers or senior care workers. See below on social care. Dependents have a generic right to work, that they can be employed by the NHS in other sector or work. So when you're on the dependent visa, even if it's a student dependent, you're not restricted, you can always work, but you cannot practice as, I think, as a doctor or a sports person. I think there are two categories of job that you're not allowed to do. I've got 13 scenarios that was published by NHS to further explain what they mean by this, and I'm sure that you will definitely fall in one of the scenarios. Now, just as you can see on my screen, the first one, example, current health and care visa holder. Let's say you're a nurse. Mohammed is a nurse from India. He moved to the UK with a 3-year health and care visa in December 2022 and works in NHS Trust as a Band 5 registered nurse. His wife, Fatima, and child, Ashvi, joined him in UK in March 2023. Fatima works as a program manager in the private sector. When Mohammed comes to renew his visa, he will need to continue to be paid at the appropriate banding for his role and at least 23,200. Fatima will retain her right to work in the UK and will continue to be able to live in the UK with her family. Now, Mohammed and his dependent will continue to be exempt from the IHS. So because Mohammed has been on this visa, he will continue to be exempt with his family from the IHS. The second scenario, as you can see on my screen, like I said, this is from NHS for employers. Health and care visa holder, Band 3 healthcare assistant. Maria is from Spain and is sponsored by an NHS trust as a Band 3 healthcare assistant. She has been in post since May 2021 and her visa is up for renewal in May 2024, which means she was given 3 years C.o.S. When Maria first came to the UK, she was on the first pay point of Band 3. Since she has been in post for over 2 years, she has progressed to the second pay point of £24,336. At the time of renewal, she will have to meet the salary threshold of at least 23,200, which is the current one now. Since she's on the second pay point, she meets the salary threshold. She came to the UK 2 years ago. At the time of renewal, she's already earning 24,360. So she's already above the salary threshold required for renewal. So Maria will continue to be exempt from the IHS and is able to bring dependents with her. Future health and care visa holder, Band 3 healthcare assistant, which is a code 6131. Hannah is from Sweden. She'll be looking to apply for a Band 3 healthcare assistant role, SOC 6131 in NHS in August 2024. After the new visa rules, this role will be on a national pay scale but is not included on the immigration salary list. Salary will need to be at least 23,200 and be paid at the appropriate banding for her role, whichever is higher. Hannah will therefore be able to work as a healthcare assistant in any area with a London waiting added to her salary. That is entry-level Band 3 in fringe areas. That's £23,957. However, location outside of London area will not be able to meet the salary threshold. That is entry-level Band 3, 22,816. Unless employers recognize previous equivalent work outside of the NHS Terms and Conditions of Service Handbook, Annex 23.11 relates to starting salary. I'm going to leave this link as well on the description of this video so you can read more about it. However, Annex 23.17 and Section 12.2 states that employers have the discretion to take into account any period of employment outside the NHS where these are judged to be relevant to NHS employment. Anna will be exempt from the IHS, which is the Immigration Health Surcharge. Hannah's wife, Julia, will be able to join her as part of her application. Julia will be given a general right to work as Anna's dependent and will also be exempt from the IHS. So we need to pay the increased immigration health surcharge, which is £1,035 per year per applicant. So if you get a 2-year C.o.S, it has to be £1,035 times 2 years per applicant. Current skilled worker visa holder, financial advisor. Remember, this person is getting a job with NHS. For everyone who has been asking me, oh, I'm told that if I get any job with NHS, I don't have to pay for immigration health surcharge. Just as you can see, Francisca is a Band 7 financial advisor from Italy. She has worked at NHS Trust for 2 years and is due to extend her visa in 2025. Her husband Anthony moved to the UK with her as part of her visa and works in construction. Francisca is wanting to continue with her current role, which is not on the immigration salary list. She would therefore be exempt from meeting the new salary threshold. However, her employer will need to ensure that she is paid according to her banding and progress in line with resident workers and updated with the 25th percentile using the latest pay rate. Francisca will need to pay the increased IHS of £1,035 per year for herself and again for Anthony, who is her dependent. Now, Anthony will continue to maintain his right to work as Francisca's dependent and can continue to live in the UK. Now, for everyone who had asked me about the IHS, like you can see that this person is a financial advisor with NHS but still have to pay for IHS. So you are not exempt except you are applying for the health and care worker visa, then you are exempt. Now, future skilled worker visa holder. George is a Band 6 graphic designer from France. Just replace France with your country. He has been offered a role at NHS Trust for £35,392 starting in June 2024. The role is included on the immigration salary list, which has a salary threshold of £30,960. Therefore, George meets the salary threshold for this role, so he will be able to bring his partner Margaret and child Bella as part of his visa application. George and his dependent will be required to pay the increased IHS of £1,035 per year per person and will be given the right to work. The difference is that George does not need to meet the salary threshold of £38,700 because he's applying for a skilled worker visa. Guys, please like and share this video with your friends and loved ones. I'm sure they are going to benefit from it. The next example, as you can see on my screen, current health and care visa holder, that's care worker. Justin is from Spain. Always remember to replace Spain with your country, and is currently working as a care worker at a private nursing home that is CQC registered in Essex. Josie currently earns £24,000 a year. He lives in the UK with his partner Matilda and two daughters, Mia and Jessica. Matilda works as a shop assistant in a local supermarket. When applying to extend his visa, he will need to meet at least £23,200, which he does on his current salary. His partner and daughter will be able to continue to stay in the UK, and Matilda will retain her right to work. They will also continue to be exempt from the IHS. Remember, he's working and is earning £24,000. Now, this next scenario, as you can see on my screen, future health and care visa holder, senior care worker. Sarah is a senior care worker from the Philippines. She has secured a role at a care home in Newcastle. Her role is on the immigration salary list, which means there is a salary threshold of £23,200. Sarah's salary offer is £24,000, which allows her to come to work and live in the UK. Sarah will not be able to bring dependents to travel with her. She will be exempt from paying IHS. So Sarah is not going to pay IHS, and at the same time, she's not able to bring dependents with her. The next example, as you can see on my screen, current dependents of those on a health and care visa, senior care worker. Now, Robert is married to Anita, who is from Spain, works as a senior care worker at a private care home in Lincolnshire. They moved to the UK 4 years ago. Robert has the right to work in the UK and is employed as a chef. Now, when Anita comes to renew her visa in 2025, she will be expected to meet the salary threshold of £23,200. Robert will keep his right to work and can continue to live in the UK. Now, the next example, as you can see, future dependents of those on a health and care visa, care worker. Jasmine is from Turkey and looking for work as a care worker in the winter of 2024. Her role is on the ISL, and she will need to make at least £23,200. Her partner Emia will not be able to join her as part of her visa application. If he wishes to come to the UK, he will need to be sponsored individually by an employer or look for another route. Jasmine will be exempt from IHS. That even if you're couple, you can come on separate sponsorship. Next on my list, as you can see, current dependents employed by an NHS trust, skilled worker visa, hotel manager. Gemma is married to Rafael and they have a young son. Rafael is a hotel manager employed on a skilled worker visa at a local hotel. She has worked in this role for 2 years on a 3-year visa. Jame has a right to work in the UK and is employed as a Band 2 porter at the NHS Trust. When Rafael renews her visa, she will not be subject to the £38,700 salary threshold. As she's already en route, her pay would be expected to increase in line with the resident workers. Jamo, Rafael and her son will need to pay the increased IHS of £1,335 per year per person. Rafael will still be able to live in the UK with her dependents. Jamo will retain his right to work. Future dependents employed by an NHS Trust skilled worker visa, civil engineer. Krux is from the USA and has a job offer to come to the UK as a civil engineer on the SOC 2121. In the autumn of 2024, he has a wife and 3 children to support and would like them to be able to move to the UK with him. Now, Clark will need to ensure that the job meets the £38,700 salary threshold. This role is not on the immigration salary list. He will be able to bring his dependents with him as part of his visa. His wife, Clara, will be given the right to work in the UK. She can apply to roles in the UK, including as a HR officer, in which she has previous experience in an NHS trust. The family will be required to pay an IHS of £1,035 per person. Second to the last example, as you can see on my screen, current dependent on the family visa, British national employed by an NHS trust. Anthony is a British national working as a sonographer at an NHS trust on a salary of £28,407. He has been married to Holly, originally from Australia, for 5 years. Holly is currently in the UK working in childcare on a partner visa, family visa route, which is set to expire in 2025. Now, Holly will need to renew her visa before she can apply for indefinite leave to remain. Since Holly was in the route before the new immigration rules came into force, Anthony will not have to meet the increased minimum salary threshold of 29,000 salary threshold on the family visa route. He will need to meet the minimum salary threshold which was in the place when Holly first applied for her visa. So Holly can continue to live and work in the UK. Holly will need to pay the IHS of £1,035 per year. Last example that NHS has further explained this to us is for future dependents employed by an NHS trust on a family visa. Kathleen is a British national working as a financial advisor in Yorkshire. She's currently married to Chris, who is a resident of Japan. Chris is wanting to join his wife in the UK in the summer of 2024 and work in the NHS as a Band 3 healthcare support worker. To do this, Kathleen will need to meet the increased minimum salary threshold of £29,000. If Chris wishes to come to the UK in 2025, Kathleen will need to meet the higher threshold of £38,700. Like we know, this will further increase for the family visa. Chris will be subject to IHS and be given the right to work in the UK. He will be able to apply for any roles as a healthcare support worker across the UK. So just on the last paragraph, that the government has reassured us that while it is determined to reduce net migration, it understands the importance of international education, health and care workers. We understand that these changes are likely to result in a number of questions, especially for international education staff and those working on international recruitment. So please see the facts below and continue to check the NHS employers and Gov website for latest information. So just as you can see with me that they have explained this in different categories. I hope this answers all your questions. And just in case you need more clarity, like I said, I'll leave all the links in the description of this video. If you've actually come to the end of today's video, I know this video is very long. I'm really sorry about that. But at the same time, I wanted to answer all the questions in just one video. So it's going to help a lot of people. So if you find this video helpful, please do like and share with your friends and loved ones. I'm sure they will also find it helpful. And also do subscribe if you're yet to join our beautiful family. And until I see you in my next video, guys, do take care and have a lovely day. Thank you very much for watching. Bye bye for now.